Let's talk about herniated discs and why they're causing you pain. Hi, Dr. James Vegher here again, and I'm a specially trained doctor of physical therapy who focuses on helping people solve their joint pain issues. Every year, 3 million people are affected by herniated discs that can cause pain in their arms and legs. I'm going to break down what a herniated disc is and also show you a movement to ease some of the associated pain. But I believe pain management is more than just fixing one area. It's about retraining the muscles in your body to work properly, so I'm not going to stop there. I've created a short quiz designed to identify your individual joint pain issues and give you a personalized plan to recovery. So make sure you stick around to the end of this video for more details. In between each of the vertebrae in your spine are these things called intervertebral discs. The discs serve primarily as cushions that are supposed to absorb shock when you move your spine, but they also serve to assist in mobility. The discs have a tough exterior and a soft center like a jelly donut. And just like a jelly donut, if you push on the donut, the jelly will push out. This is what happens with a herniated disc. The inside gets pushed out through a tear or weakness in the tough exterior fibers. This herniation in turn causes pain because the rupture pushes on the nerves and other tissue. When the disc pushes on the nerves, it can also cause weakness or numbness and create pain down the leg or arm. The most common herniated disc happens in the lumbar spine or your lower back. It can also happen in your cervical spine or your neck, but that is less common. When you have a lumbar herniation, you usually feel the pain in your legs or buttocks. In fact, sciatica is one of the most common symptoms, so if you feel a sharp pain from your buttocks down the back of your leg, you might have a herniated disc. Typically, discs get worn down and injured through repetitive strain that is placed on them. Eventually, the strain leads to tissue breakdown. Something else that affects your discs is compression. This refers to the pressure that is placed on the disc through your spine. If you are not stabilizing and holding your spine correctly, your discs will have excess pressure placed on them. This could eventually lead to disc damage and herniation. I want to show you how to combat the pain you might be feeling if you do experience a herniated disc. But first, you need to know that this advice is intended for a broad audience and you may require more specific attention. You need to understand that if I was working with you one-on-one, I would be able to provide treatment and guidance on all of the facets of your pain. There is much more that goes into solving your problems that encompasses your whole body, and I encourage you to check out my other videos for a more comprehensive approach to solving your pain problems. If you're having severe pain from a herniated disc, you need to seek one-on-one medical attention. So with this exercise I'm about to show you, we're going to accomplish two things. The first is we're going to actually change the curvature of your spine to move in the direction that will take some of the pressure off the intervertebral discs. The second thing that it's going to accomplish is going to take away those compressive forces that you have moving from your spine, from the top of your spine down through the bottom of your spine, which actually pancakes or squishes your intervertebral discs. So this exercise is done on your hands and knees. So let's get to that position. So when you get into this position, there's a few things that you need to know to set yourself up for success. The first is making sure that your knees are slightly wider than your hips and that they're turned out. So your legs shouldn't be facing straight forward, but the knees are turned out slightly and your feet will be sort of facing each other, pointing towards each other. As far as your arms are concerned, you want to make sure that your hands are flat against the ground. You don't want the weight of the hands to be out towards the pinky side of the palm. You want it evenly from the pinky side across to the thumb side. The elbows shouldn't be locked out. They should be slightly bent. This is going to help take some of the strain off the elbow joints. Try to get your head away from the floor. Now, when it comes to the back, if you're experiencing pain due to a herniated disc, the best thing I'm going to tell you to do is just let your back relax fully. When people do this exercise and they don't have a back problem, we typically want to keep the back in a flat, straight line. But if you're experiencing pain due to a herniated disc, allowing your back to drop down is perfectly fine. In fact, it's going to give you a greater pain relief. So this is really what I encourage you to do, is allow your back to drop. When you allow your back to drop a little bit, it hurts, that's okay. Move away from that bottom position slightly and just practice letting your back drop and moving out of it slightly. Not back up into this position, but going from letting it relax to a little less relaxed and then allowing it to relax again. Eventually, as you do this, you'll notice that you'll be able to let your back relax all the way without pain. So once you're in this fully relaxed position, what you're gonna do next is you're going to move slightly backward towards your heels without letting your back round up. People with herniated discs tend to have a stiffness in their hips, which causes their back to round when they start going into hip flexion. So this exercise is meant to combat that, to allow your back to be in a good, stable, healthy position for your discs and not let your hips influence that. So the exercise looks like this. Back is relaxed. I begin to rock back, not letting my back round up. Always remember to listen to your body and stop immediately if you have pain. Also, be sure to check out my other videos on sciatic pain for even more pain relief tips. And I didn't forget about that free quiz I promised you. All you have to do is click the link down below in the description, and it's going to take you to a page where you fill out the quiz to help me identify your unique needs and get you a personalized recovery plan. If you learned anything helpful, please share this video with a friend and click that thumbs up button. If you're new here, hit that subscribe button so you can get more tips and tricks for pain relief and corrective exercises. Be sure to leave me a comment letting me know how this worked for you or other pain relief tips you'd like to see. Until next time, take care of yourself.